What's the current recommended treatment for catatonia, and how effective are these treatments?
For a patient who has catatonia and is manic or psychotic or depressed, the first effective treatment, the first active treatment, is benzodiazepine. These are drugs which are sedatives. They have a direct effect on the brain, and it is important that the dosage be given adequately, which is higher than the usual dosage for benzodiazepines. That is, they are used mainly as a sedative and help people sleep. And so the usual dose is 0.5 milligram or 1 milligram once a day. But for catatonia, the minimum we need is 4 milligrams a day. That's how we start with most patients. And we have patients who need as many as 30 and 40 milligrams a day. About 70% of patients respond to benzodiazepines and stay well. About 30% do not. They do not get better with benzodiazepines, even at the high dosage. And we have to give them the alternative is electroconvulsive therapy. If you induce a seizure in a patient who has a catatonia and is not responsive to benzodiazepines, a matter of 3 to 6 seizures, and they get much better. Actually, the recovery with seizures is rather quick. That is, after 2 or 3 seizures, the patient is much better. But if you stop treatment at that point, they become ill again. And so we have developed the idea of continuation ACT. Continuation ACT is a method where patient is treated perhaps 2 or 3 times a week for 3 weeks, then twice a week for 2 weeks, and then over the next 4 to 6 months, once every occasion that they need it. How do we know that they need it? They become depressed, mute, don't act very well. And so we give them another treatment. Ordinarily, the catatonia that has been treated now with benzodiazepines first and then ECT second, it takes about 4 or 5 months. And usually by the time 6 months have gone by, they're well.